Good afternoon, everyone. We are 1 minute out. Good afternoon, everyone. I'm Nirav Shah, the Director of the Maine CDC, and I am joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to be with everyone this afternoon to talk about where things stand with respect to COVID-19 for today, Wednesday, February 9th, 2022. I'll begin by providing an update on where things stand from a public health and epidemiological perspective, and then turn things over to Commissioner Lambrew. We begin this afternoon's update on another sad and unfortunate note. Maine CDC has recorded 3 additional deaths associated with COVID-19. One was an individual from Kennebec County, another from Somerset, and the third from York County. One was in their 70s and 2 in their 80s. One was a woman and 2 were men. These 3 deaths bring the total number of deaths in Maine associated with COVID-19 to now 1,819. We'd like to take a moment to offer our condolences to the friends, family members, and communities of all of those who have passed away with COVID-19 throughout the pandemic. As of this morning, Maine CDC had recorded 183,499 total cases of COVID-19. And the backlog of positive tests that are waiting to be processed now stands at 53,000 cases. In terms of hospitalization, there have been significant reductions in the number of people hospitalized in Maine with COVID-19. As of this morning, there were 304 people in Maine hospitals with COVID-19. To put that number in perspective, 2 weeks ago, 1 incubation period ago for this virus, that number stood at 408. Today, it now stands at 304. We've seen similar reductions in, say, for example, ICU admissions, where right now there are 70 people who are in an ICU in Maine with COVID-19. However, 2 weeks ago, that number was at 88. For non-ICU patients, there are right now 234 patients, whereas 2 weeks ago, that number stood at 320. And similarly for ventilator use, where right now there are 27 people in Maine on ventilators with COVID-19, but 2 weeks ago, that number stood at 38. Turning now to testing, where we have seen significant reductions in positivity rates as well. The PCR positivity rate in Maine is now at 10.2%, whereas 2 weeks ago, it stood at 17.4%. Testing volume for all PCR tests remains at 532 PCR tests for every 100,000 people. Overall, right now as a state, the Maine CDC is receiving 1,057 positive test results every single day on a 7-day basis. And that includes both PCR and antigen results. That's what's being reported into the Maine CDC every day. That 1,057 is a significant reduction even as compared to 1 week ago, when that number stood at 1,665 just last week, the last time we spoke with you all. A quick reminder, if you are looking for testing, options are available. For example, the Augusta Armory is offering PCR testing at no cost to you without an appointment from 9 a.m. to 3 p.m. Monday, Wednesdays, and Fridays. There are also other community testing sites available. For example, in Windham, in Biddeford, in Auburn, and in Bangor, just to name a few locations. For more information on testing availability and locations, please go to maine.gov/COVID-19. Turning next to vaccines and vaccinations, where right now, Maine is administering 1,725 doses of COVID-19 vaccine every day right now over the past 7 days. And 58% of all of the shots that are being given over the past week are boosters. And finally, one note just to go back to something we talked about last week around contact tracing. I want to take a moment again to review the changes to contact tracing that we discussed last week, and in particular, zero in again on what they mean for you. Maine CDC is no longer reaching out to you if you are a close contact of someone with COVID-19. But this does not mean that the fundamental goal of contact tracing has gone away. That is, to notify folks that they may have been exposed to COVID. That's why, if you test positive for COVID-19, the first thing you should do is isolate. But the second thing you should do is to notify the people in your lives who are your close contacts. Similarly, if someone calls you and tells you that they now have COVID and that you are a close contact, you may need to quarantine. The Maine CDC website has been updated to help you figure out what you should do if you test positive for COVID-19, or if you get that call from a friend saying that they've tested positive. The bottom line is that we ask everyone to notify their close contacts, and if you are the one who gets notified, to take appropriate steps. That's based on your vaccination rate, whether your vaccination status, and whether you're vaccinated, fully vaccinated, or boosted. So with that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Director Shah. I'm excited to announce that starting today, Maine is distributing $116 million in Maine Care payments to home and community-based service providers to pay bonuses to more than 20,000 direct support workers. These bonuses may be used to attract new workers or to retain current frontline employees. These employees provide a broad range of services, including personal care, home care, behavioral health, shared living, and community and work supports. The bonuses aim to address the short-term COVID-related worker shortages and are closely aligned with Governor Mills' Maine Jobs and Recovery Plan, which makes significant investments in improving and expanding our healthcare workforce. The bonus payments are available thanks to the American Rescue Plan, and they represent an important component of the department's plan to improve access to high-quality services that help ensure Maine people of all ages, including those living with disabilities and behavioral health challenges, can remain in their communities. As Governor Mills said, direct support workers are a vital part of the healthcare workforce that has been the backbone of Maine's response to COVID-19. We thank them for their efforts. With that, I'll turn it back over to you, Director Shah, for questions.
Great, thank you. Let me turn to our colleagues in the media. And the first question for the afternoon goes to Patrick Whittle.
Thank you very much. And thank you for the update. We would love to know if Maine CDC has any thoughts on the latest guidance or lack of coming from the White House about mask use. Is there any new guidance coming from the state about that subject? It's been a while since we've seen anything at the federal level.
Yep. Now, Patrick, are you referring to mask use in the general population or zeroing in on schools?
I was going to start with the Gen Pop and then segue into schools, but you did it for me.
Okay. Well, let's start with the entire state as a whole. No changes there, and there the U.S. CDC's recommendation that folks who live in counties where the transmission rates are high or substantial should wear masks in indoor public settings. That's 99.9% of the U.S. right now, including all of Maine's 16 counties. But with respect to schools, Patrick, for months throughout this entire school year, teams from Maine CDC have been meeting with school leaders to understand how public health measures are working out at the school level. We are continuing those meetings, including one this week with members of my team and school superintendents to understand better where we are around a variety of mitigation measures, masking, testing, et cetera. This process is really important because it helps us learn from superintendents about what's going on in their communities. This is the same collaboration, for example, Patrick, that helped us make recent changes to school-based contact tracing in a thoughtful way. We're going to do the same thing when it comes to other mitigation measures as well, especially as things are improving with respect to COVID. Now is the time for us to be having these discussions. Although, of course, timing matters. Even though things are better, COVID's not over. And we're excited about the vaccine that is in the offing for the youngest group of kids. But we also have to remember that children are being affected right now. So we're going through that process, the same process that we've used to consult with schools to understand what's going on. We're going through that and continuing that process as it relates to other mitigation measures. And one note, Patrick, although you didn't raise this, there has been a notion out there that Maine has a statewide mask mandate as it relates to schools. That's not the case. What we're actually seeing is the opposite, which is other states moving in the direction that where Maine has been throughout the school year already.
You mean allowing the individual district to set policy about masks?
That's right, making it a matter of local control and community choice.
Okay, thank you very much for clearing that up.
Yep, thanks, Patrick. Let me go to Rebecca from the Ellsworth American next.
Hi, Dr. Shah. Thanks for your time. My question was actually about masking in schools as well. So that has been answered. So I'll let us move along, but thank you.
Thank you, Rebecca. Very thoughtful of you. Let me go to Brian Sullivan next.
No such luck with me, Dr. Shah. So I think last week when we spoke, the term endemic has been bandied about a bit, and you said that maybe it wasn't what I thought it was, or I'd just love to give your definition of what endemic is and how far away we are from this elusive place.
Yeah, sure thing, Brian. Now, of course, I'm not, neither the commissioner nor I is in the prediction game. And so we can't make any predictions, but there certainly has been an uptick in use of that term endemic. And I think folks are attracted to it because it begins with the word end. But it's not what the term means. Endemic by public health folks and epidemiologists really refers to a disease that has a constant presence in a population, but is not overwhelming, for example, health systems, or affecting a significant fraction of the population, which is what we typically see in a pandemic situation. So that's what differentiates an endemic state, which is that constant presence, from a pandemic state or epidemic state, which is a significant market increase in case growth. So that's the bottom line on the differences between the two.
And without being in a state of prediction here, what would need to happen in Maine would be that, I don't know, hospitalizations become half of what they are now. Is there a metric that you would use to say when we would go to, when would we declare that?
Yeah, an endemic state is not something that is declared. It is something that, in retrospect, historians may look back upon and say, this was around the time that the disease flipped from being an epidemic or pandemic type of growth to where it was in steady state. Historians of prior pandemics do that when they look at, say, the 1918 flu or the cholera outbreak in London in the last century, 2 centuries ago. So it's not something where, at least so far as I'm aware, there's a switch on the wall that somebody somewhere is going to flip and say, we are now in an endemic state. It's more of a concept that describes where things stand, mainly in relation to where they were before.
Okay, thank you.
Let me go to Patty White next.
Thanks, Dr. Shah and Commissioner Lambrew. I'm hearing some confusion from people about quarantine and isolation times. I spoke to someone who had a family member who was severely ill with COVID, and they visited them about 2 weeks after the person tested positive and then they got COVID, and they found out after the fact from a doctor that if you're severely ill with COVID, the isolation time is 20 days. And I think they didn't realize that was in play, that length of time was in play because the standard is 5 days. And I've also heard confusion from employers about what policies they should use, 5 or, is it better to play it safe and do 10? So I was wondering if you can just clear up some of the confusion and what nuances do you want people to be aware of and the exceptions to kind of that 5-day recommendation.
Sure, Patty. The number one thing I want people to be aware of is if you have COVID, to please visit the Maine CDC website or the US CDC website. Both have sections on literally titled what to do if you have COVID. I think the US CDC's one is called If You Have COVID, What Do You Do Next? They also have a similar section on if you've been exposed, what to do next. Because those websites, ours and theirs, spell out the general approach, but also some of the nuances and exceptions that you noted, Patty. So the very first thing to do is isolate. But the second thing is to check the website to see if any of these types of exceptions apply. A lot of the quarantine and isolation guidance, Patty, is based on the idea that someone's symptoms have resolved or that they never had symptoms in the first place. But a major exception to them, or a precondition of them, is that if you still have symptoms, even mild symptoms, you've got to wait X number of days without taking any medication until your symptoms have resolved. For some folks, that might be on day 5. Others, it may be on day 8. Others, as you noted, Patty, it may not be until day 10 or 20. That's because being symptomatic is a pretty good indicator that someone is still capable of spreading the virus in significant enough quantities to get someone else sick. That's all, again, laid out on the website. So the first place for folks to go is to check that out. The other large category of potential exceptions are for folks who have, for example, immune system deficiencies that mean that their body may take more time to clear out the virus. Again, there are others as well, but those are the primary two, Patty. And both of those, when in effect, may mean longer isolation periods as well as potentially longer quarantine periods if you've been exposed.
Okay, thanks.
Mhm.
And the first results of wastewater testing are in. I know there's not a lot of data yet, but what sort of stands out to you in terms of that initial data?
I will just reiterate the note that you mentioned, Patty, which is that the data are still coming in, and it takes several weeks to establish a real viable baseline, because the real essence of wastewater testing is how it compares to the prior period. And for that, we want to have a solid baseline in place. The data that we are putting up on our website are from locations that have had at least 2 weeks of testing, but that's still not really enough for a baseline. So with that as an upfront disclaimer, the data are encouraging and track what we've seen with respect to things like hospitalizations, as well as ventilator and ICU usage, which is to say a lessening of the disease burden right now in Maine. There have been some counterexamples to that, Patty, so I don't want to say it's been universal amongst all the sites. There have been some sites that started downward and then either stabilized, or in one case even had an uptick. This is to be expected. We're a large state, so we've got to make sure we get a baseline in place first. The early suggestions are that the news matches and tracks what we've seen in things like hospitalizations, but our team is still looking for a few weeks more data, and then we'll be able to really tell on a week-by-week basis what's changing.
All right, thanks very much.
Thanks, Patty. Chris Costa, over to you.
Hi, Dr. Shah and Commissioner Lambrew. Can you both hear me okay?
Sure can, Chris.
Okay. My first question is for Commissioner Lambrew. And I just wanted to clarify, Commissioner, on the bonuses that you announced. Will that be, because you talked about it as an ability to potentially recruit more staff. Does this also play into the fact of helping people who are in hospitals, either for behavioral care or people who are seeking that long-term care but can't get a bed yet? Is that what these bonuses are trying to impact, or am I misunderstanding?
So these specific bonuses that we announced today are for home and community-based care, not for institutional care for psychiatric hospitals or nursing facilities or residential care facilities. They really are for home and community-based care. But let me explain why that matters, because we still have a challenge that our hospitals are facing called people awaiting placement. Many of those placements are going from one level of care, like inpatient hospital, to a nursing facility or residential care. Some of those patients can be discharged to home and community settings with the right supports. These direct support professionals are those people, the home health aide, the other sorts of personal support person who can help those people who can't necessarily function as independently as they might like, have those supports in their homes or in community-based settings. Some of those community-based settings do include group homes, but we really are trying to support the full array of services in Maine. And we're just very excited because this part of the workforce has been on the front lines of trying to keep people out of hospitals in the first place, but also helping them as they are transitioning to their communities.
Understood. Okay, thank you. That's helpful. Dr. Shah, I had a question for you, just something we've talked about in a couple of different of these briefings. We've heard that the symptoms of Omicron are milder. And I guess one thing I want to understand a little bit more about that is just kind of the context. Can you compare, and I know this is going to be hard to do. Every patient is different ages, different underlying health conditions, so on and so forth. And I'm wondering if you've been able to tease out a way that can actually put into context how or why those symptoms are milder compared to perhaps somebody who had Delta, or just as an example. I'm trying to understand what it means when these symptoms are milder.
Sure. Thanks for that question, Chris. And you appropriately caveated it. These are our generalities, not necessarily patient specific, because if you've got Omicron and you're very sick and you need to end up on a ventilator, milder compared to what? Milder for whom? So let's start with why it's thought, to your question, why it's thought that Omicron may present with milder symptoms in those who get it. And it has to do with the places that the virus tends to migrate to in the body and infect. The virus infects the entire body, but viruses also home in on certain places. And the Delta variant in particular was thought to affect the lower part of the lungs and the respiratory system and cause disease that was harder to treat, and as a result of that, a lot more severe. Omicron is thought to infect the upper part of the lungs and respiratory system just a little bit more, such that the symptoms may be milder. But the emphasis there, Chris, needs to be on the last two letters. Milder is not the same as mild. As we've seen, Omicron can still cause significant numbers of hospitalizations, ventilator use, and death, mainly because of how much more contagious it is. On a person-to-person level, it may be good news that the symptoms might be milder, but they are still not mild.
Okay, that's helpful. And my last question, kind of along the same vein, is a bit of a follow-up to that. I know we've talked a lot about the cases in kids under age 5. It does appear the Maine CDC's data for the month of January is now complete. It looks like January just blew every other month out of the water for kids in Maine that got the virus. And I guess I'm trying to understand, why are we seeing this drastic rise in the cases in that age group now? Why didn't we see that with Delta?
Well, we did also see it with the Delta variant, Chris. Make no mistake. In fact, what the variant era of COVID has been characterized by, going all the way back to Alpha, way back when we still knew them by letters and numbers, what the variant era of COVID has been characterized by is putting to bed the notion that kids can't get COVID or don't get it or don't transmit it. They most certainly do. And we started seeing that really truly emerge with the Alpha and Beta variants, about a year and change ago now. We saw it even more with Delta, but because of Omicron's significantly higher contagiousness rate, that's when the lines really started diverging and more kids being affected by it. Thankfully, what has held true is that kids are not as severely affected as adults. They can still be severely affected. And there are kids hospitalized with COVID-19 in Maine, and there are some of the other symptoms and syndromes that can accompany that. So I don't mean to downplay it for a second. What I'm suggesting is that they are not as affected by adults, and that has held true throughout the various variants that we've contended with. Chris, that's another reason why, again, we've been in conversation with superintendents, and that's driven in part by things getting better. But you're correct to point out that better does not mean over.
Okay, thank you very much.
Thanks, Chris. Emily Bader, over to you next.
Hi, good afternoon, Dr. Shah. I'm wondering, first of all, if you could, I saw that the Maine CDC posted those wastewater surveillance reports. And I'm wondering if you can give kind of a how to read those reports for dummies overview, because I am no scientist and I look at those and I'm deeply confused. So I imagine some readers are as well.
Yeah, I'm glad you read that, or you asked that, and I don't mean to answer your question in any manner to suggest that you fall into the category that you suggested. Those reports are a little bit Byzantine, and in fact, we had a meeting not too long ago, or a briefing with the scientists who devised those reports to brief and educate Maine CDC epidemiologist on that. So they are technical, but we're all learning as we go along. So what I can share from that meeting, Emily, is there are really, I think, two graphs to zero in on when you see those reports. They're typically a 2-page PDF. And there are two graphs. The first one is the one on the front page, which shows in a heavy blue line the rates of COVID that are found in the wastewater. And that is a useful one to look against, just to see, again, as I mentioned with respect to Patty's question, what the trend has been over a couple weeks. It's not so important to know how many copies you've got per liter of wastewater today. What you really want to look at is where has my municipality been over the past 4 weeks, 5 weeks, 6 weeks, and where does that relate to where we are today? And that first graph with the heavy blue line is the way to get a sense of that. The other graph to look at is the one that's on the second page at the very bottom. It's a long rectangle with a bunch of vertical lines in it. And what that one shows is where your municipality's wastewater stacks up with the hundreds or soon to be thousands of other municipalities in the country relative to how much COVID there is there in the wastewater. That just gives you a sense of where your municipality is relative to the rest of the country. And I think it's interesting, and I think it might be instructive to see how that number changes as well. But when I look at those data, Emily, which I try to do is as soon as I get the email, I spend 90% of my time studying that graph on the first page, particularly the changes in the heavy blue line.
Okay, second question. Looking at the data that characterizes deaths by county and age and gender, it looks like that for young people, this past December was a particularly deadly month, that more young people died during those months than any other time. And I'm wondering if you could maybe provide some insight into that, because as Chris noted, Delta seemed like it would be those months. And then second, I find it interesting that hospitalizations peaked the month following. And wondering if you could provide context into that. Is that, the death and vital statistics still need to catch up with hospitalizations, or what's going on here?
Yeah, so we'll start with the former. Emily, you're right. December was a month characterized by the Omicron surge, where we had an increase in deaths. That really does exemplify the point that Chris and I discussed, which is something that may be milder on a person-to-person level doesn't necessarily mean it will translate to fewer hospitalizations and fewer deaths. Because even though Omicron may have been milder on an individual level, the fact that it spreads so much more easily means that so many more people were infected. And thus, even if the same percentage or even a smaller percentage of those people are hospitalized or die, the overall number is much bigger. And that's what you saw happening with respect to Omicron. I would add on top of that, Emily, where those deaths occurred in the counties in which those individuals hailed is also instructive. We saw a lot of those deaths occurring in individuals from Oxford, Franklin, Somerset, Piscataquis counties in particular. Well, sorry, really, truly the first two, plus Androscoggin County. And it's important to note, and I think point out, that at least two of those counties, Oxford and Franklin, are lower on the vaccination tables. And so I think that's yet another reason to go out and get vaccinated. We're now seeing really clear data suggesting that vaccination rates, particularly low vaccination rates, unfortunately correlate with high death rates.
Okay, thank you.
Mal Meyer, over to you.
All right, thanks, Dr. Shah. My questions are going back to the issues of masking in schools, just because so many other states, including just now Massachusetts, are planning on rolling back those mask mandates in schools. I know that you said that you're having these conversations with districts and plan on having more. Will the state be offering any metric guidance to help districts make these decisions?
So Mal, let me start. I don't think you were implying this, but just for clarity, Maine does not have a statewide mask mandate in place. What other states are doing, Massachusetts and in recent days, Connecticut, Delaware, et cetera, are essentially adopting the approach that Maine has taken throughout the school year, which is one of allowing schools and districts to make that choice at the community level. Now, as it relates to the next wave of mitigation analysis and where we go with that, certainly metrics are a part of that, but there are also qualitative factors. And that's why, for me, it's so important for me and my team to meet with school leaders and superintendents to understand, for example, how these various measures are working and going at the school level. In recent days, I've received an uptick in emails from parents of students who have various challenges with their own communication, who find masks to be an impediment. I want to hear about what those look like and hear from superintendents about how these things are playing out. So as we've done throughout the pandemic, there will be quantitative factors that are involved, Mal, but there are also these qualitative factors that we've got to take into account as well.
Yes, and then just sticking with this for a little bit, and you mentioned that that there really hasn't been any updated guidance just quite yet. Do you expect the US CDC to come out with some new guidance in the near future surrounding masks in school?
I'm not sure, Mal. I have not had any indication that they will do so. And indeed, yesterday, Director Walensky reaffirmed their guidance. So I'm not sure if they on their end are reevaluating it.
I know in talking to some school districts, they are going to be taking a really harder look at just some of the metrics in their community, in their schools, and things like that. What are some of your concerns as districts potentially reconsider their universal masking rules?
Well, I wouldn't, and Commissioner, please weigh in here. I don't know that I wouldn't frame that I have any concerns, Mel. I mean, this is one reason why it's really important, again, for me and my team to meet with school leaders so we can hear about what's on their mind and make sure we're working with them on that. So what we've been working with on schools and what I'm hoping to glean and talk about with leaders this week is we all know that things are thankfully improving. That's a good thing. We also know that for a lot of folks, they want COVID to be in the rearview mirror. We want to balance that with the fact that there are still cases happening. As Chris noted, a lot of those cases are among kids. But so my approach, it's not a concern. My approach is just to try to make sure we're balancing all of those things in a judicious manner.
And I will just add that, we are looking at all of our protocols, including pool testing in schools. How does that work as we are entering this new phase? Kind of the different spacing options that some schools have adopted. So we're looking at all of the above. That's what we do, especially in light of changes. But I do want to add that we're really proud of our partners in schools. We have been able to keep our classrooms open. We have hit these challenges when there have been quarantines and isolation that have affected our schools, but quickly rebounded. So we're just hopeful that the pragmatic approach that our schools in Maine have taken, informed by public health and shared interest in safe in-person learning, continues.
Thank you.
Thanks, Mel. Jessica Piper, over to you.
Thank you, Dr. Shah. I was wondering if you could talk about plans in place for if a vaccine is approved for children younger than 5. What is the rollout of the availability of that vaccine going to look like if it is approved in the next couple of weeks? Sure
thing, Jessica. We are encouraged by the recent news that the FDA will be meeting next week, as their advisory committee will be meeting next week, followed soon thereafter by the CDC's advisory committee, also right now slated for the end of next week. Those are solid and tangible steps that will hopefully mean that the vaccine is here in the not too distant future. What we've understood from CDC, and as well as in talking with parents and pediatricians, is that a lot of parents, as well as their doctors, will want and prefer kids to be vaccinated in an office, in the office setting, by a clinician that they know and a clinician that they trust. So that will be a venue that we think will be utilized. That is to say, the pediatrician or family practitioner's office. But early on, there will be a lot of parents who will be eager to get their kid vaccinated and not be able to find an appointment. So our team has been working with the existing locations in Maine where vaccines have been offered for over a year now. I'm talking about the Marshalls down in York County, operated by York County EMA, Central Maine Medical Center's site at the Auburn Mall, so on and so forth. We're working with them to make sure that as soon as practicable, after the vaccine is fully authorized, if that happens, that those sites are also able to administer the vaccine for parents and their kids who want it. We're also looking at whether there are geographic gaps that we need to think through and try to fill early on to try to minimize the amount of driving that folks have to do. If you're looking to be an early adopter, that may, as it has throughout, entail some degree of driving, but we're looking to see how we can add additional sites, for example, even here in Central Maine, to see if we can relieve some of that.
And then with respect to that specific vaccine, I think there was some confusion last year with some of the early data that came out and something not meeting an antibody threshold. Could you kind of address what is known about the effectiveness of this vaccine?
Yep. So more will come out next week, Jessica, particularly in advance of the US FDA's meeting. And I imagine those data will be out over the weekend or on Monday, again, in advance of that advisory committee meeting. The point that you are referring to is that for the Pfizer vaccine, for the population of kids that were studied from the ages of 2 to 5, the vaccine was safe. But it did not meet their pre-specified threshold for how many antibodies are generated. It did in the younger group from 6 months up to 2, but not in that middle group. That was not unexpected because these are really thought to be a 3-dose series. So the manufacturer, Pfizer, is continuing their study with the 3rd dose. But in light of the increase in cases of COVID-19 in kids, going back to Chris's question, the US FDA, I'm told, the US FDA felt it was appropriate to move ahead with analyzing what we know about the vaccine right now, while the data on the 3rd shot are forthcoming. Joe Lawler, over to you next.
Hello, good afternoon. Just continuing on the masking question, something I wanted to have clarified. The meeting that you're talking about with the superintendents, has that already happened or is that to happen this week?
Both. So I've been meeting with superintendents throughout the school year, more recently as we were working on changes, Joe, to contact tracing that we rolled out about a month ago. So those meetings have been ongoing. There is also another meeting this week to continue that conversation that's been ongoing. This week's will be, as the commissioner and I have noted, more focused on other mitigation measures like masking, pooled testing, baseline testing, things like that. So both.
So the one that is happening this week, is that today, Thursday, Friday?
It's tomorrow, Thursday.
And do you think that, and I realize we're talking about recommendations and not mandates, but do you think that as a result of these meetings that there will be new recommendations forthcoming?
I can't predict that, Joe. These meetings are not outcome driven. We've had these so that my team and I can hear about how these public health recommendations are actually working at the school level and what the benefits and what the limitations and drawbacks of them are. I don't want to predetermine any particular outcome from these. We are clearly talking about what is the future of some of these mitigation measures, be it masking and testing, but I don't want to suggest that there's a predetermined outcome in mind.
Okay, I'm not asking whether there will be a predetermined outcome, but whether you think that it will result in some type of recommendation, whatever it might be.
It's possible, Joe, but I don't want to get ahead of the conversation. Part of it depends on the fact that there are still cases that are occurring in the schools and things like that. I mean, certainly the reason we're having the discussion is partly to understand how things are going on the ground, but also in the context of evaluating whether the recommendations are appropriate based on how things are evolving in the pandemic. But whether or if anything were to change, I don't want to, I can't predict that. As you're aware, Joe, as we've talked about, the US CDC still does recommend masking in school settings.
Okay, and then my final question is, other states, and again, regardless of whether this is a mandate or a recommendation, other states have, and New England states have put a date on the calendar, February 28th, whatever the case may be. Do you think that's a good approach to have a date on the calendar for when we might see masking be optional, or is that jumping the gun?
Yeah, I think that too is jumping the gun there, and I know you've already put this disclaimer in, but I just have to state it again. They're doing a different thing. They're putting a date on the calendar for when they will adopt the approach that Maine has already taken. So they're doing a different thing than what we're doing. But I want to see how the conversations go, as well as see how the data evolve. I don't know that for us right now, putting a date on the calendar or even thinking about it in terms of a date is where we want to be.
Thank you.
Thanks, Joe. Let me go to Corey from WAGM.
Good afternoon, Dr. Shah and Commissioner Lambrew. So my first question is for Dr. Shah and the CDC. It's with the rise in popularity of the at-home COVID tests. Now, if those tests are positive or negative, those aren't generally reported to the CDC. Are you concerned at all that the CDC is not seeing an accurate snapshot because these tests aren't being reported?
Well, Corey, that's an unfortunate limitation of at-home tests. It's one that we've grappled with since when they first became available. Gosh, way back when. And I think for us, the way we think about it, Corey, is all of these new innovations that come out, whether it's at-home tests or what have you, they have positives, they have strengths, and they have some limitations. In our view, and I think the view of other states, the benefits of at-home tests greatly outweigh that limitation that you noted, that the results aren't reported. They're faster. You can do them in the privacy of your own home. They're less expensive often than PCR testing is. And you get a result in just a matter of minutes rather than overnight. And so those benefits to us, to me at least, outweigh the drawback that you noted, which is that those results don't get reported in. What I think is really important, Corey, is that if folks are using at-home tests, they treat that result as if it were being reported. That is to say, they go online, if they test positive, look up what they need to do, isolate and notify their close contacts. That is really the most important thing. Isolating and notifying your close contacts and letting those contacts know that you're positive is more important than letting us know.
Thank you. And my second question is, we've heard from a number of nurses in our area that they are still testing positive, even though obviously they're fully vaccinated. Most of them are boosted. Why do you think we're seeing, and actually they're saying more so at a rate than before the vaccine and before everything like that? Why do you think we're seeing more nurses and healthcare workers that are testing positive, even though they are fully vaccinated and boosted?
Well, there are different ideas there, Corey. That's certainly been something that's happened throughout the pandemic. Folks may be several days after their isolation period has ended and still test positive. That's one reason, for example, someone who just recently got COVID in the preceding 90 days and tests positive again is not considered a new case of COVID. They're someone who may have tested positive again, but they're not a brand new case. Because even if they're unvaccinated, we know that at least for 90 days or so, the body's immune defenses are sufficiently strong that being reinfected again doesn't mean you've got a brand new bout of COVID. But one of the other things that's going on here, Corey, is that there's just so much virus around. Omicron spreads so quickly and so ferociously from person to person that it's not surprising that folks who are constantly exposed, like healthcare workers who are doing their duty and being on the job, are more exposed because of so many people around them having Omicron. The best thing that all of us can do to prevent healthcare workers from having those repeat exposures is, to no one's surprise, going out and getting vaccinated. Let me go to Sean Murphy next.
Hi, Dr. Shah. Thanks. Most of my questions have been answered, but I just wanted to tag on one more thing about the wastewater treatment testing. Do you anticipate that as the data becomes more consistent and you're happy with what you're seeing, that this is going to be something that will be part of the daily updates being sent out to the public?
Well, Sean, it's going to be on our website. And so I think that will be the venue in which we communicate it to the public. It's already on the website. We put the snapshots of those PDFs on there. We're working on having a more graphical dashboard. And so I think the website with those reports and an interactive dashboard, both on our website and the US CDC's website, that'll be the primary means of communicating those data and sharing it with the public.
Okay, thank you.
Thanks. And the last question for the afternoon goes to Camille from Seacoast.
Hi, Dr. Shah and Commissioner Lambrew. Thank you for taking my question today. It's related to schools, and I know you've answered the bulk of some of my questions, but I still have one more. I'm wondering if you have a sense for what, if anything, you would recommend to superintendents when they're factoring in the mental health of students in making these decisions about loosening restrictions. Additionally, I'm curious if you've given thought to addressing the mental health of some students who might be confused or experiencing anxiety by less mitigation in place.
Sure, I can start, but again, Commissioner, please weigh in here. Camille, as your question kind of noted, there are challenges on both sides. And that is one of the difficulties in navigating a situation like this, because there are different groups of students who may react to changes differently. I don't presume to be, nor would I ever presume to be, an expert in childhood mental health and the challenges they face. I can only relay what, based on the emails that I've gotten, reports that I've read, that we know that kids out there are having a tough time right now. Again, on both sides, based on where they come at this and how they're thinking about COVID themselves. My goal in meeting with school officials and school and education leaders is to hear about those and understand what it means for public health policy going forward.
Yeah, and I will just add that the challenges that our young children, youth, and everybody in schools is facing are pretty intense because of the pandemic. The disruption in not just in-person learning, but in extracurricular activity, play dates, engagement with other kids has been significant. That's why we've been partnering with the Department of Education to try to figure out how do we bring more supports for mental health into our schools, be that trainings for the existing staff and school nurses that are there, looking at special programs that we could be bringing into school for social emotional learning, and considering options like telehealth to make sure that we are providing on-site in schools some of those supports, because we realize that the COVID-19 pandemic has affected us all. It has particularly affected kids. And so we're trying to strengthen our supports via schools and childcare providers and other venues to make sure that we're giving kids the kind of help that they need to get through this.
Thank you both for your response. May I ask just a quick follow-up to that? The telehealth, I'm curious, I know that you're in the early stages of these conversations, specific to this, or you're still speaking with superintendents regularly about these sorts of issues. Is telehealth something that the state is considering implementing on a larger, broader scale? Have there been more conversations about providing that to students?
Absolutely. So at the beginning of the pandemic in 2020, recognizing the challenges of in-person mental and behavioral health and physical health care, we really aggressively in the state of Maine changed our policies to support telehealth, from making sure that all of our different insurance companies cover it, to supporting our providers in connecting with the technology to deliver care that way. In fact, Maine was a leader in the nation of providing kids telehealth during the pandemic, looking at our Maine Care data. So we're proud of the record that we produced during the pandemic. our goal right now is to continue it, knowing that in rural areas, in areas or schools without school nurses, we need to do something different to be able to connect kids with those services. And indeed, we learned that some people prefer telehealth to physical engagement to have a behavioral health counseling session, for example. So we have been working on our telehealth policies. We'll continue to do that. What I referenced previously is a new initiative to try to really anchor some of the telehealth for mental health in our schools throughout the state. That's a work in progress. We're hoping to get that going this school year.
Have these conversations also been, would you apply them to school administrators and teachers who have been feeling strained and possibly also burned out over the last 2 years? Are there conversations that are keeping those folks in consideration?
Absolutely. So we have a program called strengthenme.com, which is all about providing different groups of Maine residents with supports to deal with the stress and anxiety of COVID-19. We have specific people who can help with our school staff, recognizing that teaching during the pandemic, being a bus driver, being an administrator has been particularly challenging. So we do offer those services at strengthenme.com.
Thank you both so much. I appreciate it.
Thanks, Camille. And that is the slate of questions for the afternoon. Commissioner, anything from you to close us out?
Sure. I'll just say we are pleased to have another week of positive trends, and we hope that they continue. But regardless, we want to thank Maine people. We remain among the states with the highest vaccination rate and lowest death rate in the country, largely due to our health and long-term care providers, businesses, schools, employers, and residents who work together for this outcome, as well as the leadership from Governor Mills and Director Shah. So thank you all.
You should include yourself in that group as well, Commissioner. But with that, thank you all for your time this afternoon. Thanks to our colleagues in the media for spending some of their afternoon with us. We hope everyone has a great afternoon. As always, please be kind and take care of one another. Thank you all.